Today, we will speak about mouth ulcers. Most of us, at some point in our life, had to go through the pain and discomfort caused by mouth ulcers. Mouth ulcers are small, painful lesions that develop in our mouth. Some of these ulcers are as tiny as dot, while some are large. We find these ulcers on our lips, cheeks, gums, and tongue. They are usually red, yellow, or white in color. These ulcers are so painful that it not only causes difficulty in eating but even while talking. Let's look into the cause of these ulcers. Different kinds of oral bacteria thrive inside our mouth, and it's a great habitat for these unicellular microorganisms. Our mouth is constantly moist and has a neutral pH, so it provides a perfect environment for these bacteria. Sometimes we hurt the delicate mucous membrane inside our mouth while brushing, chewing on a hard candy, biting while chewing, or because of artificial dentures. When an injury occurs, the bacteria in the mouth gets into the injured portion and starts to grow in number and thus forms an ulcer. The white blood cells tries to fight with these bacteria, and that is why the white boil is seen on the top surrounded by the red area. Because of the deficiency of vitamin B12, iron, zinc, or folate, the mucous membrane inside the mouth thins and ruptures, again giving a chance for bacteria to grow in the ruptured parts. Other than deficiency and bruising, there are other reasons also that can lead to mouth ulcers. If a person has ulcer-causing bacteria, Helicobacter pylori, in his stomach, there are chances of getting frequent mouth ulcers. People suffering from acidity or gastritis also tend to get frequent mouth ulcers. People who are allergic to gluten in wheat or are lactose intolerant, if they happen to consume it, ulcers tend to occur after around 12 hours of consumption. Some people get ulcers on consumption of highly acidic food like lemon, intake of spicy food, or nuts. We may feel lime is vitamin C, so it's good, but it's too acidic and our mouth does not respond well to too much of acid. Intake of alcohol or certain medicines can also irritate the lining of the mouth. Some people are allergic to sodium lauryl sulfite found in certain toothpaste. Use of such toothpaste can also cause ulcers. So, the first thing that you have to do when you get a mouth ulcer is to find out the reason. If it is due to brush, start using a softer one. Change your toothpaste, bring changes in the food consumed, and start having supplements of iron and vitamin B12. You can also try some home remedies like the usage of honey, because honey is antibacterial, applying a paste of baking powder over the lesions, gargling using salt and water. Mouth ulcers usually last only for 3 to 4 days. And for people with low immunity, it may last for around 10 days. But if it stays longer, check with your doctor immediately. Hope you found this video informative. Thank you.